Hello and welcome to today's lecture. I'm Ibulani and I'll be guiding you through today's topic. In this session, we'll be focusing on nursing management for patients with pleural effusion. I hope that you've read your textbooks before you watch this video. We are going to review and deepen your understanding about the topic, and this lecture is designed to give you clear, practical insights you can use. We'll walk through the key concepts step by step with examples and explanations to make things as straightforward as possible. So, grab your notes, settle in, and let's get started. Before we begin, let's take a quick look at our learning objectives for this session. These objectives will guide our focus and help you understand exactly what you're expected to learn and take away from this lecture. By the end of the session, you should be able to understand the pathophysiology and medical management of pleural infusion. The second one is you are be able to formulate appropriate systematic nursing assessments, diagnosis, intervention, implementation, and evaluation for patients with pleural effusion. Here is the critical points that you need to remember related to pleural effusions. The pleural space normally contains approximately 5 to 15 ml of serous fluid, which function as a lubricant between the parietal and visceral pleurae, facilitating smooth respiratory movement. Pleural effusion refers to the pathological accumulation of excess fluid within this space and represent a clinical manifestation rather than a primary disease. The regulation of the pleural fluid depends on the balance between hydrostatic pressure, oncotic pressure, capillary membrane permeability, and lymphatic drainage. Disruption in this balance, such as increased pulmonary capillary hydrostatic pressure, decreased plasma oncotic pressure, increased pleural membrane permeability, or impaired lymphatic outflow, can result in fluid accumulation within the pleural cavity. For this pleural effusion, we classify it into two main types, transudative and exudative, depending on the protein content. A transudate occurs primarily in non-inflammatory conditions, and for the exudative, it results from increased capillary permeability due to inflammatory reaction. They most often occur with infection or cancer. And also, there is another type of complication. It is empyema. It is the collection of purulent fluid in the pleural space. It is often caused by pneumonia, tuberculosis, lung abscess, and also infected surgical wounds of the chest. Okay, here is the interprofessional care or medical management for patients with pleural effusions. The management of pleural effusion is to treat the underlying cause. There are 4 points related to the interprofessional care. The first one is treat the cause. First, we treat whatever is causing the fluid buildup. For example, if it is heart failure, then we give diuretics to remove extra fluids. If it is an infection, then we use antibiotics. The second one is drain the fluid. To relieve symptoms like shortness of breath, we may need to drain the fluids from the pleural space. A procedure called thoracocentesis can remove the fluid with a needle. If the fluid keeps coming back or is in a large amount, a chest tube may be placed to drain it continuously. The third one is to prevent fluid return, and if it is needed. In some cases, especially with cancer, we can use chemical pleurodesis to seal the pleural space and stop fluid from building up again. The next one or the last one is the sportive care. For the sportive care, oxygen therapy are needed if the oxygen level is low, and also we need pain control based on patient's condition. Okay, next. As a nurses, our role is critical in monitoring respiratory status, managing symptoms such as deep snore and chest pain, and also supporting intervention like thoracocentesis when needed. Through careful assessment, timely intervention, and patient education, we aim to improve the patient's comfort and prevent complication. I will now outline the key nursing priorities and interventions involved in the care of the patient. The first step is nursing assessment. We begin with assess the respiratory status of the patient, look to the respiratory rhythm, deep of respiration, observe for deep snoo, the use of accessory muscles, and also cyanosis. We may need to auscultate the lungs to hear the decreased or absent breath sounds on the affected side of the pleural effusions. We also need to monitor the vital sign continuously, especially the temperature for the risk of infection, to see the blood pressure, pulse, and also the oxygen saturation. The next one, we need to assess the pain. Evaluate the chest pain as the clinical manifestation of this pleural effusion, especially related to pleuralytic pain that worsens with breathing and coughing. The next one is fluid balance. We need to monitor and assess the input and output because it may be altered due to systemic causes like congestive heart failure or liver and kidney failure. The last part of nursing assessment is we combine and we integrate it with diagnostic support that the doctors ordered before, like we support and prepare for imaging to take the x-ray or maybe ultrasound or CT. And then we need to monitor and take the lab results for ABGs, CBC, and also pleural fluid analysis. After we do all the assessment, then we come into a nursing diagnosis. There are five possible nursing diagnoses that may show up in patient with pleural effusions. The first one is impaired gas exchange that may be related to fluid accumulation in pleural space. Second one, ineffective breathing pattern related to decreased lung expansion, acute pain related to pleural inflammation, risk for infection, especially if the pleural infusion is emphysema or secondary pneumonia, and the last one is anxiety related to respiratory distress and also hospitalizations. Okay, after this, we are going to talk about the nursing intervention. There are five main intervention that related with the diagnosis of that related to the nursing diagnosis. The first part is respiratory support. We can position the patient in high rollers to maximize the lung expansion, giving oxygen therapy as prescribed, encourage deep breathing exercise, and also coughing, monitoring for signs of hypoxia and respiratory deterioration is really, really important. Second intervention is thoracocentesis care. We can prepare the patients physically and psychologically before the procedure. We assist during the procedure with sterile technique with the doctor, monitoring for post-procedure complications such as pneumothorax, bleeding, re-expansion of pulmonary edema, and also the last one is we document amount and appearance of the fluid removed from the procedures. The third intervention is chest tube management if it is inserted to the patient. We need to ensure the patency and proper function of the drainage system, monitoring and record drainage amount and characteristic, maintain sterile dressing around insertion site, and watch for sign of infection or tube dislodgement. The fourth intervention is pain management. Of course, we collaborate to give prescribed analgesics to the patient, PRN or as needed, and also we can use a non-pharmacological methods like positioning and relaxation techniques to relieve the pain. The last intervention is monitoring for complication because pleural effusion is really dangerous and progressive sign of disease, then it may escalate to the complication such as respiratory failure, emphysema, recurrent effusion, infection. That's why we need to understand the clinical manifestation for its complication. So if the patient are having the tendency to have one of the complication, then the nurses is already aware of the signs and symptoms that may happen. Okay, after all the intervention and also um, all the implementation that we give to the patient, of course, we need to evaluate the result of the nursing intervention. We need to focus on the patient respiratory and ensure the patient can breathe normally, and also the vital signs within the normal range, and the most important part is the patient is not having any complication. It's all the evaluation that we can do to the patient. And the another important thing related to pleural effusion is because it is not a disease, it is the sign of another disease, that we really need to pay attention to the root cause or the main etiology of the um, effusion that happens. Because if the main cause is not treated well, then it can come back come back again and make um it more complicated. That's why it's really important for us to treat the underlying cause too. Okay, I think that's the end of this video. We've covered the key points of nursing management for pleural effusion, and I hope it really helped you to understand the topic better. It may not cover all the um, things related to effusion pleura, but you have your textbook, you can watch another video, you can dig into the journals or evidence-based practice to seek more deep understanding related to this topic. And also, I need you to review what we've discussed with your friends, and feel free to revisit this video whenever you feel you need a refresher. And at last, thank you for watching and see you in the next video.